My name is Dr. Denise Cooper. I actually started at the University of Michigan-Flint quite a few years ago, and I got my BSN from here. And then after that, I ended up going to Ann Arbor, and I got a master's degree as a nurse practitioner. And I started working here as faculty and was encouraged to go back and get my doctorate. And I ended up getting my DNP from Ann Arbor also. So a BSN to DNP with MSN is for those students that already have a bachelor's degree. They're a registered nurse and have a bachelor's degree. When they're in the program, they can get their MSN along the way. So the MSN conferment happens at a certain point in the program. And then after that, they can get board certified and they can practice as a nurse practitioner, which is very desirable to students. And then they can continue on and get their DNP degree in about another year. So our program, depending on what track you're in, we have a full-time and part-time track, and we have a fall start and a winter start track. Each of those is just a little bit different, same courses, tiny bit different order. It's 5 to 8 semesters to get that MSN conferment, and then you have to add 1 year to get your DNP, but don't forget you can be practicing in between while you're getting your DNP. Well, we have a place for you. So we have a program called the RN to DNP with MSN program. That is for RNs that already have an associate's degree or they have a diploma and they decide that they want to be a nurse practitioner. So they can come into our program. They'll be at the undergraduate level at first. They can either get their BSN along the way or they can skip the BSN and go straight on through to their DNP. Don't forget they get their MSN conferment along the way so that they can get board certified and practice. So we actually have a team of people that actually go out into the clinical sites, make contracts with them, affiliation agreements, and find the best quality placements for you out in the community. We try to do them local to the campus, but we have students from all over since we're mostly an online program. And so what we try to do is to get the students close to their homes. So if you're in Michigan and you're 2 hours away, we're going to try to find those clinical sites for you and get those contracts at the best sites that are within an hour of your home. Whether it's grad or undergrad, we have cultural competence threaded throughout all of our courses. And also in grad, we have evidence-based practice. So those themes are in every single course and every objective of every course, and we carry those through and thread them through. As nurses or nurse practitioners, we take care of a lot of different cultures, and understanding those cultural practices so that you can care for them appropriately is important so that they get good care. So we think it's important enough that we teach our nurses how to take care of family members and patients of all cultures.